it's time to step it up a notch and either tell me you're either going to help me or you're not. Don't blindside it anymore. I don't say, well, you're going to listen to this or you're going to do this or you're going to, wait for this. There's no more waiting. Time is out. Like, I'm at the end of my rope now. I ain't got much longer. And I need your help now. Because if you don't help me, I'm going to die.
Syd Fizzard for Rebel News, and today we have an interview with Sheila Annette Lewis, who is considered an ideal candidate for organ transplant by Alberta Health Services and her doctors. But after completing every necessary requirement to receive her transplant, a new rule was added. She would now have to get the COVID jab. This was something Sheila could not do. The JCCF fought alongside Sheila against AHS, arguing charter violations. Ultimately, the court sided against her cause, even going so far as to make her pay the legal fees of AHS and the hospital in question. While awaiting a Supreme Court decision, Sheila and her former lawyer discovered she had natural immunity, something the doctors refused to test for. This new finding prompted her to request to be put back in the line for transplant, but instead, doctors said she would then have to get the booster as well. Even though the Supreme Court dismissed her case, Sheila continues to fight on for her life by other ways, and is now taking AHS to court for medical malpractice with new legal counsel. Sheila has also been looking into international options, such as a hospital in the United States that isn't enforcing these same restrictions. Unfortunately, this does come at a cost, currently estimated at around $600,000. Many have begun to help Sheila and her family with these fees by donating at givesendgo.com/GAMM5. We have a detailed report highlighting everything you need to know about this situation, how we got here, what it means, and what comes next. To see that report in full and all our coverage of this story, go to organsnotcoercion.ca. We sat down and spoke with Sheila for that exclusive report, and today we share with you her story in this extended interview.
I'm just going to leave this on.
How does your diagnosis affect your physical and emotional conditions?
Well, my physical, it's really hard. I can't get up and do anything anymore. It's hard for me to get around because my oxygen numbers dropped so bad and my heart rate was up really high. So I got to stay as quiet as possible. That's my physical. I can't do it. Like I can't make my bed. I can't cook anymore. Can't do hardly anything anymore. And that plays on your emotional well-being because you really do. It plays on it. You don't feel like worthy anymore. You have no dignity left because it's little by little it's taken away because it's a hard question to answer. So it's you depend on other people to survive, and just for something simple as feeding you, getting the proper nutrition. I think the hardest part for me is not being able to clean my house on my own anymore, or go grocery shopping. I can't make decisions like that anymore because I can't get up and do it. So it plays on your mind, and you don't feel full anymore. I feel like a nuisance because everybody has to start their life in order to help me, and it's not fair. It's not fair to them. Even though I appreciate everything they do, they shouldn't have to go through what they go through because of me. So that's what makes it so hard.
You are no longer receiving help from AHS for your transplant, it's my understanding. And can you explain what this has meant in a literal sense?
AHS and the transplant doctors, it's true, they no longer help me. They don't do any testing or anything like that. They just kind of leave me here. And I just don't understand how they can do that to me. These doctors don't care about their patients, and it's like, when did they stop caring? I thought doctors were supposed to care about their patients and do no harm. Where did the level, of care stop, and what made it change? And yeah, so I just don't understand any of it anymore. Uh, it's like they don't even want us here. It's like when they do Zoom call me every 3 months, once every 3 months, the only question they ask usually is, how you doing? You're hanging in. You're still here. And then they say, how is your breathing? Has it advanced? And I usually tell them, yeah, I'm doing okay, though. Holding my own. That's the thing they say. You're holding your own. It's like, yes. Like, what a lovely thing to say. Like, well, okay, Annette, we'll give you a call another 3 months, see how you're doing. So to me, it's like they're only calling to see if I'm still alive.
Smith, before you disappear, can I just ask what experts you talked to with regards to Sheila Annette Lewis? Yep.
Now, I asked Premier Smith what experts she spoke to, and I also asked her what advice did they give her. Here's the comment from the Premier's office. Many medical factors go into the determination of eligibility for organ transplants, and criteria is therefore decided by a panel of qualified medical professionals and not elected officials. What's your response to this answer?
She believes what she believes and whatever she's saying, but qualified doctors, I thought doctors were supposed to do the surgery on me. Transplant doctors were supposed to do the surgery. I didn't think they were supposed to play God. And as far as this life-saving surgery for me and many others that were denied, it comes down to the question of the vaccine. And the biggest sin is that people with an compromised immune system was never supposed to have gotten this vaccine. And that's not a theory. That's a fact. And it came out in the Pfizer dump that anybody with an compromised immune system was never supposed to get this vaccine. So why are we being made to take this vaccine for life-saving surgery? And I'm sorry, but don't make it political on people that are dying. You have the power to overturn this decision.
Although we saw the Supreme Court's dismissal, you do have new legal action against AHS for medical malpractice. What is the difference between this case and the one that the Supreme Court dismissed?
The one that the Supreme Court dismissed had nothing to do with medical malpractice. It's a constitutional challenge, it was. And it was challenging the doctors because of the decision that they made around a table in the transplant unit, all 6 doctors. And they made a clinical decision to say anybody that needed life-saving surgery needed to get a vaccine. Well, there was no data, no science when they did make that. And there was no policy. They didn't even have a written policy when they made this decision. They just made a decision around a table. They played God. And they don't have any right to play God. Their job, like I said earlier, was to perform a surgery on somebody needing to survive with a transplant.
Even though Alberta Health Services in part denied you a transplant for not taking the COVID shots and the booster, there are many transplant facilities around the world which don't require these same measures, and it's my understanding that you're in communications with one in the United States. Could you just tell me about the potential there? What's going on?
In the United States and in Texas, we were in contact with Texas, and they had said there's no reason why I can't get a transplant if my body's still strong enough and my organs are all in good shape, and my body can survive, a long surgery like that. And they said they will make a chart for me. They asked me to send my records down there, all my medical records, which I did. And they're going over the medical records now, and they will be back in contact with me. And they told me the initial for the testing, to get the testing all done again, in order to make sure my body is healthy enough to withstand this surgery. They said it would cost $100,000 for the testing, and we're going to move forward with that.
Money's a factor. People are coming together rapidly to provide their support and to show their support for you. How are people doing that? Where are they going?
They're going to the Give Send Go website, and when you log into the Give Send Go, you just put "Saving the Life for Sheila Annette Lewis," and it will bring up that Give Send Go for the transplant. I think Canadians, they don't have to donate. It's their it's their prerogative. If they want to donate, they donate. But I don't think Canadians should have even had to do this pitch. I don't think they should have been put in this position to, for us to ask the public to raise that kind of money. It's a lot on the public. They've had it the last 3 years. They've had it very hard because a lot lost their jobs, couldn't able, to go to work because of the vaccine. They lost their jobs and everything. So I don't think they should have been asked. I think Canada should have, and Alberta is the one Pacific, should have given me my transplant because there was nothing stopping them, because I have natural immunity. And someday, God willing, if I was able to get a transplant and the gift of life and I survive it all, that's where you pay it forward when you heal. I hope, and I will. One way or another, I will pay it forward somehow to Canadians, all Canadians. But my goal right now is to ask the public to please give what you can. It's not just for me. We're fighting this battle for a lot of people, and I'm hoping I win. I'm hoping with my next case, I'm hoping I win for a lot of people. If they want to give me my transplants, I'll back on it. I'll stop. But I can't stop, because if I stop, I'm going to die. And that isn't in my agenda, to die. I got to keep going. I got to keep going for everybody else.
Is your government doing anything to ensure that unvaccinated tax-paying Albertans who fund the system are still able to receive timely and appropriate access to the health care they may need to survive?
I understand that organ transplant decisions are very complicated, and they're made by a national body on the basis of survivability, and I'll defer to the experts on that.
Was saying she was going to get a second opinion, and I respected that decision, of course, because she is not a doctor, and I know that. So she ended up getting her second opinion, which we now know was Dr. Dennis Moultrie, and he's a wonderful man, and I know he tried to help me. Dennis Moultrie is still willing to work with you. All you got to do is call it. And so then she chopped it up as, well, she has a case before the Supreme Court of Canada, so maybe we'll wait and see what happens with that. Well, Supreme Court of Canada made this decision, which doesn't want to hear my case, but didn't mind putting the costs of the courts for AHS and the doctors in the hospital onto me to try to stop it. So, Danielle Smith, what is your decision now? Dr. Moultrie, tried to help you and give you the medical expert opinion of his in this case. And Supreme Court made its ruling. So now, what are you going to say? I want you to tell me. I want you to either reach out, personally to me, or I want you to tell the Canadian people that are waiting to hear a real answer from you. What are you going to do next? Or are you going to do anything at all? Because I know as Premier of a province, I know you have that power. And if you don't do anything, then it speaks volumes, where you let the very people that helped vote you in down. Uh, and, I have a lot of hope in you. I really do. And when you first came into this province and was first elected for 7 months before you got reelected again here last month, I had a lot of hope. I did a lot of praying. I had a lot of hope for you. But that hope is going away real fast. So it's time to step it up a notch and either tell me you're either going to help me or you're not. Don't blindside it anymore. I don't say, well, you're going to listen to this or you're going to do this or you're going to, wait for this. There's no more waiting. Time is out. Like, I'm at the end of my rope now. I ain't got much longer. And I need your help now. Because if you don't help me, I'm going to die. And it doesn't get any more drier than that. So I think you should try to figure out what your next step is real soon, like within a week. Because as each day goes by, I get weaker and weaker. And, or else tell the Canadian people that's what you're waiting for. Is everybody waiting in government for me to go? Is that's what's happening here? Or is it political? Let's hope not. I think I'm being... Yeah, I think it's political now. I don't think it's a matter of do no harm or a vaccine or the science. I think it's they're making an example of me. And that's exactly what it's coming down to. I am being made an example and it's not a good example. All I'm doing is asking you to help me. And I'll go away. I didn't want anything in life. I didn't want anything except a transplant to save my life. And I want absolutely nothing after that. And I just want to be able to live and be happy and live with the rest of my life as best I can with my family. And to be a good mom and a good grandma and go to work, do what everybody else does. But you need to make a choice now, Danielle Smith. You need to make it fast.
If you wish to see more of our reporting on Sheila Annette Lewis, go to organsnotcoercion.ca. And while you're there, consider signing the petition that we plan on dropping off to our health minister here in Alberta, Adriana Lagrange. We want to make sure that they know what they're doing has a real impact on everyday Canadians. For Rebel News, Syd Fizzard.